All right, hello everyone. My name is Aisa Bustos, and I'm so happy to welcome you to the 7th Annual Cannabis and Practice webinar series, hosted by the Washtenaw County Health Department and Livingston County Health Department in partnership with the Washtenaw County Medical Society. This webinar series is aimed at addressing questions our local and regional healthcare providers have about cannabis use in their patients. Our speakers come from a wide range of backgrounds and are experts in their respective fields. Funding for this series comes from the Michigan Department of Licensing and Regulatory Affairs Cannabis Regulatory Agency. To review some housekeeping notes, all participants will be muted throughout the session. Please use the Q&A box to submit questions, which will be answered at the end of the presentation. If you require a live transcription, select the Show Captions function. If you don't see it, resize your window to be wider. This session is being recorded and will be available on our county website at a later date. This live webinar has been approved for 1 social work credit, 1 McBack credit, 1 CHESS credit, 1 Mishwa credit, and 1 CME credit. If you're requesting any of these continuing education credits, please be sure to stay until the end to fill out our post-webinar evaluation survey. This webinar is being recorded, and the recording and presentation slides will be available on our website, washtenaw.org/marijuana, in the coming weeks. Before we get started, we ask that all questions for our speaker be asked through the Q&A function, which can be found at the bottom of your screen. We will have time at the end of the webinar for the speaker to answer questions. And with that, I'm pleased to introduce today's speaker, Dr. Kelly Young-Wolff. She is a licensed clinical psychologist and research scientist at the Kaiser Permanente Northern California Division of Research. She's also an adjunct associate professor in the Department of Psychiatry, University of California, San Francisco, and an adjunct lecturer in medicine at the Stanford University School of Medicine and professor at Kaiser Permanente Bernard Tyson School of Medicine. Dr. Young-Wolff's research focuses on substance use, focusing specifically on cannabis use among pregnant persons and on the impact of changes in local, state, and national policy. Her research interests include investigating how stress and trauma, genetic factors, and health-related policies shape disparities in the onset and course of drug and alcohol abuse, tobacco use, and psychiatric disorders. She's also interested in conducting research to inform the development of effective behavioral interventions for complex patients with multiple co-occurring psychiatric and addictive disorders. And with that, I'm going to turn it over to our wonderful speaker, Dr. Young-Wolff.
All right, great. Thank you so much. So I'm going to go ahead and share my screen, and then I will share my slides. There we go. All right. Well, thank you so much, everyone, for having me here today. I'm really looking forward to sharing with you what we've been learning about cannabis use during pregnancy. I hope that you'll find the talk helpful. So one of the things that tells us why this is such an important topic is this recent report that came out from the American Heart Association that identified 2 time periods that are really associated with the greatest risks for cannabis use on the brain. And those 2 time periods are exposure in utero, so from maternal cannabis use during pregnancy, and exposure during adolescence. And we now know that there's growing evidence that cannabis use in pregnancy has potential health risks associated with it. And we think that the risk might be greater now than ever before because we know that the strength of the products or the percentage of THC in products has increased over time. And so due to these concerns, the American College of Obstetricians and Gynecologists recommends that women who are pregnant or contemplating pregnancy should be encouraged to discontinue marijuana use. And those reporting marijuana use should be counseled about concerns regarding potential adverse health consequences of continued use during pregnancy. But especially at the time that we started doing this work, we really didn't know a lot about trends in cannabis use in pregnancy, why pregnant people use cannabis, what the true health impacts are, or even how to talk to pregnant patients who are using cannabis. And so our work over the last 10 years was really meant to try to address these gaps in the literature. And the data that I'll be sharing with you today come from Kaiser Permanente Northern California. So if you don't know us, we're a large integrated healthcare delivery system in Northern California, serving about 40% of the insured population. We have over 50,000 pregnancies a year. Our patients are very diverse, and we also have a robust electronic health record, which allows us to do very rich research. We also have what we call our KPNC Early Start program, and this program has been shown to have tremendous health benefits, including improved perinatal outcomes. This is an award-winning substance use screening and intervention program that's really unique because it's integrated directly into prenatal care. And so as part of this program, all of our pregnant patients are screened for substance use by self-report. They're asked about their frequency of use of different substances during the year before pregnancy and then since pregnancy. And this is done at about 8 to 10 weeks gestation when our patients come in for their first prenatal visit. And then they're also given a urine toxicology test that's done as part of standard care. It's not done based on clinician judgment about who might be using drugs, which is nice. So it's universally done for our patients with their consent. And then people who are using substances during pregnancy are provided with assessment, education, and counseling that's actually integrated into prenatal care. And so we know that pregnant patients often don't like going to specialty addiction medicine treatment. And so this intervention brings the intervention right to where they are. And so I thought it'd be fun today to tell you some of our quantitative electronic health record-based research studies. And then I'm also going to bring in some of our qualitative work where we conducted focus groups with pregnant patients who use cannabis during pregnancy in late 2021. And the reason for this is that too often research is really conducted on and about people rather than being inclusive of the people who are being studied. And so we wanted to remedy this research gap by hearing directly from the individuals who use cannabis in pregnancy, and I'm going to be bringing their voices into this talk as well. All right, so this is what I'm hoping to cover today. We'll go over what we've learned about trends, reasons for use, health risks of cannabis in pregnancy, and then ending with how to talk to pregnant patients who use cannabis. And so when we first started doing this work, we were really interested to know just how much are rates of cannabis use increasing over time. And so this was a study that we published back in 2017. It was our first study on prenatal cannabis use. And what we found was that in Kaiser Permanente, Northern California, prenatal cannabis use nearly doubled from 2009 to 2016. And this is if you consider use by any method. So if they self-report use or if they have a positive toxicology test, and that here is shown in black. But what was also really interesting to us was that over twice as many pregnant individuals were identified as using cannabis in pregnancy from toxicology testing versus self-report. So if you compare the blue line to the orange line, and this is a really important finding because to us it indicated that prenatal cannabis use has likely been underestimated in self-reported surveys, which is where most of our data up until this point had come from. So then we wanted to look if the trends varied by age group, and here you can see that while rates of prenatal cannabis use were actually increasing significantly over time for all of our pregnant patients, regardless of age, we found that our younger pregnant patients, less than age 18 and 18 to 24, shown in blue and orange, were not only much more likely to use overall, but that in fact their rates of increase were going up faster. So this was really concerning to us. And it was this study that really got us interested in saying, gosh, we really need to look into prenatal cannabis use more because we want to understand what's going on. So one of the next things we did is we were curious to know as use and acceptance and accessibility of cannabis all increase, we wanted to know whether the frequency of prenatal cannabis use might increase as well. And so for this study, we looked just at the self-reported frequency of use data. Unfortunately, our toxicology tests don't tell us anything about the frequency with which people are using, so we were limited in this study to self-report. And what we found here is that from 2009 to 2017, the annual relative rates of change in all frequencies of use increased significantly. But daily use, which is shown here in the darkest blue, even though it's the kind of the smaller proportion of use, we found that it's increasing most rapidly. And so another way of looking at this is that in 2009, among those who used cannabis in pregnancy, 14% said they used every day. And by 2017, that went up to 21%. And I can tell you that out of 2004, daily use has increased even further to 29% of our pregnant patients who use cannabis saying that they're using cannabis every single day during pregnancy. And I think this increase in the number of patients who are using cannabis every single day in pregnancy really needs to be understood within the context, as I mentioned earlier, of this extraordinary increase that we've seen in the strength of cannabis products. So this primary intoxicant in cannabis, THC, has more than tripled over the past couple of decades. So we're really seeing an increase in use, an increase in frequency of use, and then we also know that people are using stronger products. And so this study received a lot of media attention. It was also tweeted by the US Surgeon General, and he included it in his 2019 Surgeon General Advisory, warning about the risks of cannabis use during pregnancy and in adolescence. And when we talked with our pregnant individuals, we heard so many stories that really complemented what we were seeing in our quantitative data. So this is a participant who said, 5 years ago, if you smoked weed while pregnant, people would be looking at you like, you're crazy. What are you doing? Who sold a pregnant person some weed? Now you might see a group of pregnant people just passing the blunt around like, okay, you all smoking, okay. We were also really curious to know, as sort of cannabis in pregnancy becomes more acceptable, whether people may be less likely to use other drugs when they're using cannabis. So traditionally, there's been this issue that oftentimes cannabis use in pregnancy co-occurs with many other substance use in pregnancy. And so it can be really hard to differentiate what the health risks are of cannabis versus the co-use of other substances. But we hypothesize that as people begin to see cannabis as more natural and they view it as safer, we might see more people who are using cannabis only who would never consider touching another substance. And so we wanted to look at co-use of other substances among our patients. And what we found was that indeed, over time, among those who use cannabis, you can see that the largest proportion of them were using cannabis only compared to cannabis and one or other more substance, or cannabis and two or more other substances, which are shown in orange and blue. So cannabis only is most common, and in fact, we found that rates of cannabis only were increasing more rapidly than cannabis plus other drugs. So kind of consistent with our hypothesis that more people now who are using cannabis are not using any other substances. And we found that co-use of cannabis and all other specific substances was going down over time, with the exception of cannabis and alcohol, which was slightly increasing over time. And when we talked to our pregnant patients, we heard themes, again, really consistent with what we were seeing with our quantitative findings. I don't know if any of you have heard of California sober, but it's this term that's used to describe people who decide to quit consuming drugs and alcohol with the exception of cannabis. And we had our pregnant patients saying things like, I don't do drugs, I don't take cocaine, I don't do heroin, I don't do methamphetamine. Do I smoke marijuana? Yeah, sure I do, of course. And this is someone who's talking about pregnancy and really just not viewing cannabis as a substance at all. So we've had a lot of our patients say, you know, when you ask us about substance use in pregnancy, you need to move the cannabis use question somewhere else because it's not even a substance. They really just don't see it as a drug. So of course, with the COVID-19 pandemic, we were really interested to understand how this impacted prenatal cannabis use. And so here, this was especially important to me because I myself was pregnant with my second son during the pandemic. He was born in July 2020. And so just really understanding sort of how stressful it can be to be pregnant during the pandemic. And so we got funding from NIH to look specifically at how the pandemic impacted prenatal cannabis use. And this was a paper that we published in JAMA. And what we found was that there was a 25% increase in prenatal cannabis use during the early pandemic. And so we looked at the 15 months before the pandemic and the first 9 months after the pandemic, and we found that there was this 25% increase that occurred at the time of the pandemic. So this was really striking. And this was based on urine toxicology testing data, which continued to happen even during the pandemic, and indicated that, you know, this is an objective measure of cannabis use in pregnancy and really suggests that, you know, we need to be able to support pregnant people and other vulnerable populations during times of stress. All right, so when we talked to our pregnant patients and we asked them about the impact of the pandemic, we heard similar things with people saying things like, I think the pandemic does increase the use of cannabis during pregnancy. People are very anxious and going stir crazy, stuck in the house, and then finding out, oh, I'm pregnant, and all these things I would have wanted to do during pregnancy, I can't do. So cannabis becomes a coping mechanism. So something else that we were interested in is whether cannabis use in pregnancy has changed with legalization of cannabis use. So California legalized cannabis for adult use or recreational use in 2016 and allowed retailers for adult use to open in 2018. And so, you know, we just didn't have a lot of information about whether legalization changes prenatal cannabis use, and a lot more data were needed. And so we tried to address this gap using data from our patients. And the first thing that we did was that in 2018, which was the year that cannabis retailers were allowed to open for adult use in California, we linked all of our pregnant patients' addresses and we geocoded them, and then we linked them to all of the cannabis retailers in the Northern California region. And we found that our pregnant patients had a median of a 12.5-minute drive to the closest retailer and a median of 2 retailers within a 15-minute drive of their home. And when we connected these two things, what we found was that having a longer drive time to the nearest cannabis retailer, so shown on the top half of this figure, a longer drive time to the nearest cannabis retailer was associated with significantly lower odds of using cannabis during pregnancy. And similarly, if you look at the bottom half of this figure, we found that having a greater density of cannabis retailers within a 15-minute drive of your home was associated with a greater odds of using cannabis during pregnancy. And so, this is a cross-sectional study, so it's hard to say the direction of effect. It could be that greater availability of cannabis around your home could lead to a greater likelihood of using cannabis in pregnancy, but it's also possible that retailers are more likely to open in communities that were already more receptive to cannabis, where prenatal cannabis might have been higher anyways. And so what we really need are longitudinal studies to look at changes over time. And so this was a paper we published last year in JAMA Health Forum, and it's the first longitudinal study using this design to look at the impact of recreational cannabis legalization on prenatal cannabis use in this way. And so here what you see is that before the implementation of recreational cannabis legalization, we see a steady increase in prenatal cannabis use over time. We see no change at the time the law passed. So in 2016, when the law passed, but before cannabis retailers were allowed to open, we really saw no effect. But beginning in 2018, when cannabis retailers were actually allowed to open, we saw this jump in rates of prenatal cannabis use. And this was based on self-report and toxicology testing. So you can see that circled here in red. And what was super interesting to us was that we hypothesized that maybe this jump would be higher among pregnant patients who lived in jurisdictions that actually allowed cannabis retailers versus those who lived in jurisdictions that banned cannabis retailers. Because even though cannabis is legal in the state of California, there's quite a bit of variability in terms of access to cannabis, because local jurisdictions can completely ban cannabis retailers. So you may live in a jurisdiction that doesn't allow retailers at all. So when we looked further to see if this was different, this increase that happened with cannabis legalization, depending on where we live, we found that pregnant people who lived in jurisdictions that allowed adult use retailers had a significant increase in prenatal cannabis use, but we saw no change for pregnant people who lived in jurisdictions that banned cannabis retailers. So this suggests that local policies allowing cannabis retailers or access to retailers may actually have a causal impact on prenatal cannabis use. And then finally, we were curious to understand sociodemographic differences in prenatal cannabis use. So this was a study we published last year that looked at changes in prenatal cannabis use from 2012 to 2022 using a really large sample size of pregnant people. And we found that overall cannabis use increased from 5.5% in 2012 to 9% in 2022. So again, in 2022, 9% of our pregnant patients are screening positive for cannabis use in pregnancy by either self-report or toxicology testing. We saw that there were increases over time across the board. So for all age groups, for all race and ethnicities, we found significant increases. But what's really striking is that there was a higher prevalence of prenatal cannabis use among our Black pregnant patients and among our younger pregnant patients aged 13 to 24. However, we found that the rate of increase was actually lower among those groups. So the rate of increase was going more slowly among Black individuals and those who are age 13 to 24. So they're higher, but they're not increasing as fast. However, you can see that by 2022, there are still striking disparities in the prevalence of prenatal cannabis use. All right, so now let's switch gears to talk about why pregnant people might be using cannabis. And I think this is such an important part of the talk, because there's so much stigma and judgment around people who use substances in pregnancy. But what we're learning is that pregnant people really do want information. They're looking for information. They want to make choices that are healthy for their baby. They often perceive little to no harm of using cannabis in pregnancy. And initial studies show that when pregnant people do try to talk their women's health clinicians about the safety of cannabis in pregnancy, oftentimes clinicians really just have limited information, or they don't respond, or if they do respond, they focus on the legal consequences of use rather than providing information about health risks. And so this really leaves patients to turn to online resources. They're going to social media, they're asking friends and family, and they're going to online community forums where they frequently receive really incomplete information suggesting that cannabis use during pregnancy is safe. And so this is just one example. If you've been pregnant, you probably know of the What to Expect website, which is sort of the go-to website for everything pregnancy related. And within that, there's a group called Ganja Mamas, where it's pregnant people who are really seeking advice about cannabis and pregnancy, talking about their reasons for use and talking about their concerns. And if you go to this message board, this is an example of the kind of conversations that happen there. So this first mom says, hey, I'm just wondering how many of you used cannabis your whole pregnancy up into labor? How did it go? Was your baby healthy? And another mom responds and says, I smoked every day, pretty much all day, up until hours before I gave birth. My son is perfectly healthy, gaining weight great, eats great, exclusively breastfed, and has no problems at all. He's 15 days old today. And then a third mom responds, oh, how beautiful. Thank you for posting. This makes me feel better about my choice to use cannabis as well. Baby girl kicks and dances and is growing healthier every day. So this really shows the kind of information that's getting shared. These are moms who are doing their best. They're asking, they want to understand whether it's safe or not, and they're just getting a lot of information that is leading them to believe that there's no harms in using cannabis. And of course, by 15 days old, right, we may not see all of the negative consequences associated with using during pregnancy. And I think it's also really interesting that this mom says that, she's exclusively breastfeeding, because that helps get this sense of people really trying to be healthy, doing all the things right, but just not viewing cannabis as something that is a negative thing to do. And so we really tried to understand, well, why are pregnant people using cannabis? And, how can we use our electronic health record data to try to get at this question? So we had heard anecdotally that our patients were using cannabis as a way to self-medicate morning sickness. And we know that cannabis has antiemetic properties, so it can help with nausea. But there had been no prior epidemiologic studies looking at this question. And so we conducted a series of studies using our data to really try to look at this association. And in one of our studies, we used our data and we found that cannabis use in pregnancy was more common in pregnant individuals who had severe or mild versus no nausea, vomiting in pregnancy. And when we ran logistic regression analyses that adjusted for a bunch of potential covariates, we found that those with mild nausea, vomiting in pregnancy had over 2 times greater odds of using cannabis in pregnancy, and those with severe nausea, vomiting in pregnancy had nearly 4 times greater odds of using cannabis during pregnancy. And so we do think that women may be turning to cannabis to try to treat symptoms of nausea. And for these patients, it's going to be really important to connect them with nausea, vomiting, and pregnancy treatments that are recommended by clinical practice guidelines, even things like vitamin B6. But it's also something that I don't think is talked about enough that I find to be super interesting, is that it's also possible that cannabis use is leading to these symptoms of nausea, vomiting, and pregnancy. And so what we're seeing is that for some of our pregnant patients who have been using cannabis daily or very heavily prior to pregnancy, when they get pregnant, they try to stop cannabis use, or they cut down or they quit. And one of the symptoms of cannabis withdrawal is nausea. And so we think for some of these patients, they're actually experiencing withdrawal from cannabis, not traditional morning sickness. And so of course it makes sense that if they return to using cannabis, they're going to feel better. And for those patients, you really want to advise them, if they can just stay off of cannabis for a week or two, their symptoms of morning sickness might go away on their own. And so I think that's a really important distinction that is not being talked about that much. Again, when we talked to our pregnant patients, many of them said they were using for this reason. This participant said, I had really bad nausea and they had prescribed everything and they kept escalating until I got to Zofran. They said there's all these possible scary side effects. And I was like, yeah, I think I'll start smoking again because that seems less scary. Another participant said, I suffered from hyperemesis this entire pregnancy. I've lost around 50 pounds in the first trimester, and cannabis was the only thing that made sure I could eat and take my prenatal vitamins. And finally, I had a postdoctoral fellow who surveyed early start specialists to ask them about what they're seeing in terms of the most common reasons for prenatal cannabis use. And 69% of them endorsed that morning sickness was the #1 reason that they're hearing from pregnant patients for using cannabis during pregnancy. Now, we also know that pregnant women have been reporting using cannabis to manage mood and stress, but again, there have been no epidemiologic studies on this topic. So this is a paper that we published looking at the association of prenatal cannabis use with mental health characteristics. And here what you see at the top is that compared to those who did not have a depressive or an anxiety disorder in pregnancy, those with an anxiety disorder, depressive disorder, or both had significantly higher odds of using cannabis. Same thing with self-reported depression symptoms. And here you can see as the severity of depression symptoms increases, the odds of using cannabis increase as well. And we also found an association with greater cannabis use among those with a trauma diagnosis in pregnancy or among those who were exposed to self-reported intimate partner violence. And when we talked to pregnant patients, they said things like, I've had depression and anxiety issues, I've been on medication, I've tried therapy and nothing has worked for me. So I think marijuana has always been a good coping mechanism. And so for these people who are turning to cannabis as a way to self-medicate mental health symptoms in pregnancy, early screening for mental health symptoms is going to be super important with appropriate linkage to interventions that might mitigate actually using cannabis during pregnancy. But again, this research is cross-sectional, and so we need more research to determine the direction of effect, because it's also possible that cannabis use can cause or worsen mental health problems during pregnancy. All right, so another question that we had was whether pregnant people might be using cannabis in pregnancy because it's legal. And so this was a really interesting study that we did. Again, this is based on focus groups with pregnant people who use cannabis. They were done in late 2021. And there was 3 primary themes that came out of this work. And the first theme was that our pregnant patients who use cannabis said, cannabis use during pregnancy absolutely went up after it became legal for adult use or for recreational use. And one of the reasons for that is just the greater access and exposure to cannabis and cannabis retailers. And so they said that they, could so much more easily access cannabis after it was legal. They talked about how available it was with retailers all over the place. While some of them were fine to go visibly pregnant into a cannabis retailer and purchase cannabis, others really appreciated the convenience and the discretion of being able to have it delivered to their home. And then they also talked about the impact of widespread marketing and advertising. So this participant said, you look at the cannabis clubs on the corner, that it's literally like a liquor store here, the easy access, the convenience. And another said, I get text messages from one of the dispensaries that I go to almost every day of their deal of the day, and I always get pissed off. I'm like, screw you, I can't use cannabis. And this is someone who's really trying hard not to use cannabis in pregnancy, but these daily texts with these deals from her favorite retailer were making it really hard to do that. They also said that acceptance around prenatal cannabis use increased after cannabis became legal for adult use. So they said there's reduced stigma around using cannabis in pregnancy. And one of the unexpected benefits of legalization was that patients reported that they're more willing now to talk with their clinicians about their prenatal cannabis use. And so this participant said, I think that if it wasn't legal and I didn't feel comfortable speaking about it in the beginning with my doctor, I may still be smoking. Because if I didn't say anything and didn't have those conversations with my doctor, I probably would have just kept doing it. And then finally, the third thing we found was that our pregnant patients trust cannabis retailers so much. They believe that products that are sold in cannabis retailers are safe for use in pregnancy. They really appreciate the diverse product selection. So they felt like no matter what ailment they might be having in pregnancy, there would be something there that could help them to feel better. And then they viewed staff as knowledgeable and caring and non-judgmental. They sort of felt like the cannabis retailer, the bud tenders or the staff who worked in the retailers kind of had the characteristics that they were hoping their healthcare providers would have that they didn't seem to have, but that they could go to the cannabis retailers for support. And so one participant said, if you walk in there pregnant, they're not going to be like, oh, you shouldn't do it. They'll show you what would be best for you during your pregnancy, depending on your symptoms. And another said they care about you. It's kind of like the doctor. And many of our patients equated bud tenders to doctors, with some believing that they received medical training or at least some training, when in fact in California, there is actually no required training whatsoever for individuals who work in a cannabis retailer. And so this trust in bud tenders is really concerning because there's evidence that they may be promoting cannabis use as safe during pregnancy. And so this was a really interesting study that was done by Dixon and colleagues in Colorado. And they found that 69% of cannabis retailers recommended cannabis for morning sickness. So they had a research assistant called the cannabis retailer saying that she was pregnant and that she was experiencing morning sickness and asked what she should do. And in this study, 69% said yes, like it will help you with your morning sickness. 36% said safe for use during pregnancy, and 32% recommended speaking to a clinician. Okay. So now let's move on to talk about the health risks. So what do we know about the health risks of cannabis use during pregnancy? So one of the things is we think that cannabis may be harmful to the developing brain because it disrupts the developing endocannabinoid system. And this plays a critical role in shaping brain development from conception all the way into adulthood. And this includes neural circuits that are involved in learning and memory and decision making and emotion regulation pretty much everywhere in the body. Now, for a long time, people would say, well, we just don't have any research. We don't know if there's any risk. And I can say that that's just no longer the case. So there's been so many studies on this topic now, and we can say through meta-analyses and systematic reviews that cannabis use during pregnancy is associated with increased risk of low birth weight babies, small for gestational age babies, preterm birth, and admission to the neonatal intensive care unit. There's also some evidence that it may be associated with attention and externalizing problems in childhood, and really less evidence for other behavioral and cognitive outcomes at this time. So some of you may have heard of the Adolescent Brain Cognitive Development Study, or the ABCD study. This is the largest long-term study of brain development and children's health in the United States. And researchers from Washington University in St. Louis analyzed the data from this study. And what they found was that prenatal cannabis use that continued after the mother recognized she was pregnant was associated with increased risk of attention, social, behavioral problems, and psychotic-like experiences all the way into early adolescence when their children were ages 11 to 12. So this is one of the largest, kind of best studies looking at the long-term consequences in children. But even the ABCD study has limitations. So as you can imagine, this is a hard topic to study. And many of the studies that have been done are limited to self-reported use and don't include objective measures of using in pregnancy. Oftentimes don't account for drug use that could co-occur with the cannabis use. Many times are not looking at frequency, and a lot of the data have been done with smaller samples and older data. And so we've really advocated for the need for additional research on this topic. And in fact, we were funded by the National Institutes of Health to study this question using our large sample size from Kaiser Permanente, Northern California. And in the last couple of years have really helped to contribute to the growing body of evidence showing that cannabis use in pregnancy is associated with certain adverse neonatal and maternal outcomes. So this was a study that we published in 2023. And what we did is we looked at a huge sample, over 350,000 pregnant individuals screened for cannabis use in early pregnancy by self-report and toxicology testing. And we found that 6.2% of pregnancies overall during this time period screened positive for cannabis use, and that cannabis use in pregnancy was associated with significantly increased odds of low birth weight baby, small for gestational age, preterm birth, and admission to the neonatal intensive care unit. So this is consistent with what other studies have found, but helps to kind of improve the body of knowledge because we had data from toxicology testing as well. So sort of a better assessment of true use. We also looked at frequency of use and found that as the frequency of cannabis use in pregnancy increased, there was statistically significantly greater risk of low birth weight and small for gestational age. So here we're seeing a dose response association with the greatest risk associated with those who use cannabis daily. Okay, so one of the takeaway messages here could be, for people who are really not willing to quit during pregnancy, that even cutting back on frequency may be helpful. This is another study that we published last year in JAMA Internal Medicine, where we looked at the health risks associated with prenatal cannabis use in terms of maternal outcomes. And something that was really interesting to us was that most of the literature had looked at baby outcomes, and there hadn't been a lot looking at the health of the moms themselves. So in this study, again, similar design, we used a large sample of pregnant patients. And in this study, we found that prenatal cannabis use was associated with a greater risk of gestational hypertension, preeclampsia, excess weight gain, and placental abruption. So as I mentioned, our work overcame some of the key limitations of prior studies. So again, we have toxicology testing and self-report. It's universally done. It's not based on participation in a research study or based on clinician judgment. We have more recent data. We're able to examine frequency of use. Because we have the electronic health record, we can also adjust for a large number of potential confounders, including mental health comorbidities, medical comorbidities, and other use of other substances during pregnancy. And then we actually did sensitivity analyses for both of these studies where we looked among the subset of people who used cannabis only and no other substances, and we found similar results. So we can be fairly confident that what we're seeing is not really just simply due to co-occurring use of other substances during pregnancy. So here's some of the next steps that we're working on now. We have a study looking at fetal loss. We actually have this study that we looked at birth defects that just was published. We're also looking at offspring psychiatric conditions and offspring substance use in relation to prenatal cannabis use. And I think it's really important, equally important to mention that not all of our studies have found associations with increased risk. So when we're looking at neonatal outcomes right around the time of pregnancy and maternal outcomes during pregnancy, we see consistently increased risk. But as we look further out, we have not found increased risk. So in our studies, we did not find an association between prenatal cannabis use and early developmental delays, autism spectrum disorders, ADHD or conduct disorder, or infant hearing loss. That's not to say that there are not associations, it's just that in our data set, we did not see those. So I think this is an area that needs to be studied further. And one of the biggest limitations of research to date is that we don't really know a lot about how pregnant people are using cannabis in pregnancy. And so you might imagine that the health risk will vary depending on whether it's smoked or vaped or whether you use an edible. And so we worked with our healthcare system and our clinical leaders to say, hey, we really need to go beyond knowing the frequency of cannabis use. We got to start asking our pregnant patients how they're using. And so we pilot tested new questions, published those data. It went well, and we were able to add those questions for all of our pregnant patients across the Northern California region. And we've been screening patients for their modes of cannabis use since 2021. And so we then used those data to apply for funding from the National Institutes of Health, and we were able to get funding to do a new study where we're looking at how modes of prenatal cannabis use relate to other substance use, maternal health and fetal loss, and local policy in cannabis retailers. So we hope to have results from those studies out soon. And I wanted to just give you a heads up on what we're seeing in terms of modes of cannabis use among those who use cannabis in pregnancy. So here you can see the breakdown with most people who use cannabis in pregnancy saying they're smoking. And again, people can endorse more than one mode, so these don't add up to 100. And we looked at smoking blunts specifically because we're really interested in the co-occurring use of cannabis and tobacco that might have special health risks. So for those who don't know, a blunt is a cigar that has been hollowed out and filled with cannabis, so you're getting exposure to tobacco and cannabis. After smoking, we're seeing edibles are pretty common. About 33% of pregnant patients who use cannabis say they're using edibles. Vaping, 22%. Dabbing, which is the active inhaling vaporized cannabis concentrate, so a high potency product, 9.9%. And then topical is really kind of less common with 4.6%. And we found that during pregnancy, about 29% of our pregnant patients who use cannabis said they use more than one mode. All right, so let's switch gears again. And now I really want to share with you what we've learned about how to talk to pregnant patients about their cannabis use in pregnancy. And we know that pregnancy provides a really unique opportunity for providing care to those who may not otherwise see a physician. And pregnant individuals, as I mentioned, are really motivated to improve their health behaviors for the benefit of their baby. So it's a really great time to have these conversations. So this is based on a paper that was led by a postdoctoral fellow, Tara Foti, who was working with me. And what she did is that she put together recommendations for discussing prenatal cannabis use based on participant feedback. So this is based on what we heard from patients who use cannabis in pregnancy. And so the first recommendation is to ask your patients about their cannabis use and be curious. So understand that they have reasons for using, and it's important to really try to understand them. So this participant said, teach doctors how to bring cannabis up in a way that isn't judgmental, just an open, confidential conversation with your doctor. There's no judgment here. The next recommendation is to listen, to really hear why they're using, rather than just saying, don't use, all use is bad. And this participant said, I want to explain to my doctor what the cannabis benefits are and why I prefer it over prescriptions she wants to give me for my pain. And then it's really important to have a dialogue. So make it a real conversation and not just a lecture. And this participant said, my doctor asked a lot of questions and listened and made me feel very comfortable. And then we've got to acknowledge the patient perspective. So reflect back to them why they're using and acknowledge their perspective. And this participant said, know that whatever choices I make, I use cannabis because I believe it's the best choice for myself. And I think once you've done these steps of really being curious and asking and listening and having a dialogue and reflecting back that you've heard your patient, then you're so much more likely to have that patient listen to you when then you go on to provide the education. And this education should be non-judgmental. And this participant said, give me the health benefits of it and the cons of it so I can make an informed decision on my own. And ultimately, our patients are going to do whatever they choose to do. And if we talk to them in a way that sort of turns them off, they will probably continue using and just not talk to us about it. So really important to have those open dialogues and then provide this non-judgmental education. And then finally, of course, to recommend quitting. And if people are not willing to quit using cannabis in pregnancy, you can provide alternatives like using less frequently, switching to non-smoked modes, giving them referrals and resources and going other options. And then again, really important to support and motivate them. So this participant talking about an early start specialist said, having somebody to be like, I'm really proud of you, we're cheering for you, that made me feel good. And this is one of our early start clinicians who I thought I would quote because I thought this was really interesting. She said, sometimes patients are like, well, I've already used cannabis through half my pregnancy, so I'm not going to do any good. I've already ruined it, right? And then she said, I like to use a phrase that every single day that baby is not exposed to THC is helping them develop in a healthier way. And some of you may have come across this. Oftentimes, people may be so scared that they've already kind of ruined their pregnancy by using cannabis that they continue to use thinking it's sort of hopeless. So being able to provide that hope, helping people to use less frequency or stop even if it's later in their pregnancy is really important. And then I have just a couple of final thoughts that I like to give when I'm doing a presentation like this. So first, it's really important to think about the role of the researcher. And so, we're extremely careful and mindful about this work and its potential both for harm and benefits. And so we, really like to have this disclaimer that our research should never be used to harm pregnant people or to penalize pregnant people or to reinforce punitive laws. Fortunately, in California, clinicians are not required to report cannabis use in pregnancy to law enforcement or social services. And this is what allows us to have universal testing for prenatal cannabis use, especially by toxicology testing the way that we do. However, we don't recommend that universal testing for cannabis by toxicology testing be used in states where there are punitive laws around prenatal substance use because those have actually been shown to be harmful for mom and baby. And unfortunately, nearly half of the United States have punitive drug use policies. And as I mentioned, there are now data, even though these are meant to help women, there's data suggesting that these simply lead to underreporting of cannabis use in pregnancy, avoidance of prenatal care and birth outcomes, missed opportunities for education and early intervention, worsening of existing inequities. So for example, we know that Black pregnant people are both more likely to be tested for substance use in pregnancy, and when they test positive, more likely to be reported to Child Protective Services. And for all of these reasons, the American College of Obstetricians and Gynecologists has recommended for a very long time removing these punitive policies. And so my colleagues and I have written viewpoints on this topic and really argued that now is the time to reform antiquated policies that criminalize prenatal substance use in favor of focusing on protecting the health of mothers and their children and ensuring equitable access to supportive and non-punitive substance use treatment. Once Child Protective Services has been called, it goes in someone's file and it can impact them later. So if you do have to make a report because of policy or mandated reporting, but you don't have any concerns, it's important to document that. Put that in your report that you don't have any concerns, and also tell your patient that it's something you have to do, but that you're not concerned. It's really important to be upfront with them about what you found and what you're going to say in the report. Be honest and really let them know that you don't have anything to hide. And then finally, I was on the committee that helped to write the Public Health Consequences of the Changing Cannabis Policy Landscape 2024 National Academies of Sciences, Engineering, and Medicine report that came out. And one of our conclusions from that report was that people who are pregnant and are using cannabis will benefit from clinical and social support, education about fetal risk, and referral to non-judgmental, evidence-based interventions or specialty treatment as needed, rather than being arrested or reported to Child Protective Services. So with that, I'd like to thank all of our collaborators and our KPNC patients, thank all of our funding sources, and I will end there.
All right, wonderful. Thank you so much, Dr. Young-Wolff, for a wonderful presentation, so much information, and loved hearing the direct quotes from all the people that you've worked with in this research. So now we will be opening it up for question and answers. So we ask that you submit all your questions through the Q&A function at the bottom of the screen. And as a reminder, this webinar recording and presentation slides will be available on our website in the coming weeks. So let's jump over to the Q&A here. The first question we have says that some research shows that cannabis has medical benefits for those with severe and debilitating nausea. Has there been any findings in regard to cannabis and those with HG during pregnancy?
Yeah, so I think this is a really new area, and it probably is likely that cannabis may help for those who have severe nausea in pregnancy or hyperemesis. We know that cannabis is an antiemetic, so it may actually be helping with some of those symptoms. But there haven't been any studies that I know of that's sort of testing cannabis versus one of the more traditional methods of treating those not morning sickness symptoms. And again, we know that the medications and the other things that are recommended by clinical practice guidelines for nausea, vomiting, pregnancy have been tested, and we know a lot about them. Whereas with cannabis, we just have it's not the same. And so again, referring women to use the sort of interventions that have been medically recommended.
Great, thank you. The next person says, it's interesting that there are so many over-the-counter meds that are safe while not pregnant, then unsafe during pregnancy. Wouldn't you expect people to understand that pregnancy might also make cannabis unsafe? Or are those individuals also taking unsafe over-the-counter meds?
That's a really great question. So it's hard for me to know for sure for everyone, but what we've heard from our pregnant patients who use cannabis, they're really how do I say it? Like they want to have a safe pregnancy. Many of them are like, I'm not going to take my antidepressant because I'm worried about the harms that it might do during pregnancy. And they believe that cannabis, they just see it as something different. They think that it's natural, it's safe, and not sometimes they'll say things like, physicians will just tell you that it's bad for you because they are anti-marijuana. And so there's not a lot of trust in that. So I don't know that people can sort of make that same connection. It seems like a lot of people are worried about using these medications that have been shown to be unsafe, but for whatever reason, it doesn't kind of go over to the cannabis.
That's very interesting. We also had a couple people share that they had experiences going to their physician and received information about THC and the risks for developing baby. And another one was surprised that there's a very popular radio host that shares her story about breastfeeding and marijuana use. And basically, they feel that they're basically advertising it, so they were surprised by that.
I would love if you are willing to share who that was. I would be super curious to try to find that. I would be interested to see that. So thank you for sharing.
Yeah. All right, the next question. Is there any work being done on bias and issues related to why people are using weed to treat morning sickness? For example, providers maybe not taking them seriously or lack of research on hyperemesis and women's health in general?
This is a really great question. I think it's something that we should be doing, and I don't know of any research looking at that yet.
All right. The next one, has there been any lawsuits against marijuana retailers for false advertising, since we have more data now that shows marijuana does cause harm?
I don't know the answer to that question. I'm not sure, but I think a lot of it is, based on what people say they're hearing, or, from this study, I do know that study that was done in Colorado, where these cannabis retailers were making recommendations that cannabis use in pregnancy was safe and effective for treating morning sickness, it actually led to some changes in the state. I don't think that the retailers were sued, but it led to a lot more awareness. And this is a cool example of where a research study really had a big impact. I had nothing to do with it, but it had a big impact on what's actually happening in public health. And so after that, I don't know who it was that brought this up, but they really did start to educate better their cannabis retailers. And there was a follow-up study done by a completely different group of people that looked at LA and somewhere in Colorado, Denver, I think, a few different places, and found that later, when this next study was done, that the results were much better for Colorado than they were for other places. And we think that might have been because of the impact of that first study.
That's great. That'd be great if we can learn from our mistakes as we
Right.
make them, All right, then there's a question about comparing tobacco and cannabis. Is there any data on the comparison of smoking tobacco and smoking cannabis, specifically the harm done to a child in utero with both drugs?
Yeah, I think that the harms associated with tobacco smoking in pregnancy are probably more clearly established and more severe if you were to compare them head to head. But we are also seeing that some of the harms for cannabis use may not show up until later. And so it's really hard to know for sure. And also the harms associated with the cannabis use may depend on how it's being used. So if we were to compare smoking tobacco and smoking cannabis, where you remove people who are using edibles, we may find different stuff. So I would say that that for sure the health risks of tobacco are well known and probably more severe, but I think we need to continue to really try to understand.
Thank you. If a patient decided to quit daily THC, do you suggest a medicine such as Zofran to help manage nausea or further withdrawal of symptoms?
I think what my recommendation would be for a pregnant patient who's deciding to quit THC would be to educate them that they could experience cannabis withdrawal, and that can go away on its own if they can just wait, kind of sort of experience the withdrawal symptoms for a week or two, and then they'll start to feel much better. So I would also recommend that they let their doctor know, what's going on, and then have their doctor work with them to find what the best intervention is if they're having very, very severe nausea, and to help differentiate what's true morning sickness versus what might be cannabis withdrawal. But just educating people that, because we have so many pregnant patients who are like, well, I felt so sick, I had such bad morning sickness, and cannabis was the only thing that helped me feel better. And of course, it's going to help you feel better if you are treating the withdrawal. And so just giving people that information could be really helpful.
Thank you. Then someone asked, what are your thoughts on child protective service workers telling parents that THC is no big deal and CPS doesn't care if THC is used since it's legal? This person says this is being the message shared when parents are using THC while pregnant and when a newborn tests positive for THC.
Oh, well, I don't know what I think about that. I'm happy that Child Protective Services is not taking away children for this, but on the other hand, I'm also think it's really important to still provide, objective information about what we know about the health risks of using cannabis during pregnancy in a way, that is non-stigmatizing, and to help people earlier in pregnancy. By the time they're at, their newborn is testing positive, it's not really helpful at that point. So trying to really identify people who are using earlier in pregnancy so that you have the chance to help them to cut down or stop using sooner would be the best way to intervene.
All right, thank you so much. And it looks like someone did put in the Q&A the information about that radio show, so
Thank you.
be sure to check that out. That is all the questions that we have here today. So I will just share some closing remarks here. But thank you again so much, Dr. Young-Wolff, for that great presentation and answering all of our questions here today.
Yeah, thank you so much for having me. And my, I don't know if my email is here, but it's kelly.c.young-wolff, WOLFF, @kp.org. You can look me up, you can find it, and I'm happy to answer any other questions that you might have.
Thank you. And thank you everyone for attending today's webinar. We hope you found it both informative and interesting. We would really love your feedback so that we can continue to improve our future offerings of this webinar series. So please use the link in the chat or the QR code on the slide to complete your feedback survey. And as a reminder, this live webinar has been approved for 1 social work continuing education clock hour, 1 specific McBAP credit hour, 1 Mishwak credit hour, 1 CHES credit hour, and 1 hour of CME. If you're requesting any of these continuing education credits, you must fill out the evaluation form with your name and email address. And for our next presentation in our series, we have Dr. Bonar will be presenting cannabis use across the lifespan in Michiganders. What do we know and what should we do? That will be tomorrow at noon Eastern Time. If you have not yet registered for the other webinars in our series, you can do so using the link in the chat or visiting washtenaw.org/marijuana. We hope to see you at the next webinar, and thank you for your participation.
Thanks, everyone.
And we will leave the evaluation QR code on the screen for just another minute.